Hey, welcome to my channel. My name is Alexandria. I'm a registered nurse and a freelance health content writer. In today's episode, I'm going to be talking about why nurses are uniquely qualified to become health content writers. If you like what you hear, please subscribe to this channel. Tell me how I'm doing. I love to hear back from you guys. Okay, so I've been a freelance health content writer really kind of on the side for about 2 years now, and I really enjoy it. Yes, there are some ebbs and flows that go with content writing, but I have never felt more free than I do now in this space where I'm finding that I really enjoy writing, and I really enjoy writing beyond the academic writing that I do, and it gives me an opportunity to still interact with people who could very well be my patients had I still remained on the floor as a nurse. And that patient education piece, it's really something that I didn't realize I would miss as much as I do. And writing is a way, especially writing health content, it's a way for me to educate from one space that can kind of reach a mass audience. And I love that. And I love seeing my name in the byline of a story that has made it to the front of, a website that's well known for health content. That warms my heart so much. It just makes me feel so good and so proud. So I want to get into why nurses are really truly qualified to be health content writers. And it's not just nurses, but we do have a unique position that really, I believe, qualifies us to be health content writers. So I'm going to get into some of that now. The first thing, obviously, is the medical knowledge that we have. Nurses typically at the bedside, especially, and even in the clinic setting, in the academic setting, and in public health and in other settings, we oftentimes have started in a direct patient care position that really has allowed us to not only flex our skills as nurses, but flex our nursing skills, but has put us in a position where we understand medical terminology and how to disseminate that and how to break that information down into digestible chunks for the everyday consumer who may not have any background whatsoever in medicine or in science. And I think that's really hard to do sometimes. Sometimes I find myself talking to people and they'll say things to me about like a medication or a medical condition, and I'll just find myself starting to ramble to them about, what I know about that medication or that condition, or that, particular procedure or something of that nature. And I always sometimes I'm surprised by the fact that I'm able to not code switch, but I'm able to communicate effectively with someone who may or may not have as much experience in medicine as I would. And more often than not, nurses do get pretty solid feedback about being able to break down information into easier terms, because we do that so much already when we are in these direct patient facing positions. It's really important to be able to communicate with our physicians, but also be able to communicate with those people who have to go home living with a certain condition, or people who are recovering from surgery or what have you. So we have a vast amount of medical knowledge that we are easily able to not only disseminate, but also able to break down into easily digestible chunks for people. I really truly believe that nurses do have a level of compassion that I won't say is unmatched to other professions, but I will say that it takes a certain type of person to take care of someone else and to take care of strangers and people who are not familiar to us or people who may not be in our communities. Not only that, I believe that nurses, for the most part, we are trained to take care of the whole person and to treat the individual and not the disease, or not just the disease. And most nurses really are providing that compassionate care that they would provide to a loved one and to a friend or to a family member or someone that they, really admire and adore. That really does take a special kind of person, and I think that compassion can absolutely come out in writing. I know for me, when there's something that I'm really passionate about, it comes out on the paper all the time. Nurses have excellent communication skills. I've mentioned this before. We are able to communicate with our physicians. We're able to communicate with our patients. We're able to communicate with family members and friends. But then we also communicate with other people on a multidisciplinary team. We are communicating with lab techs. We're communicating with pharmacists. We're communicating with social workers. We are actively engaged in the total well-being of our patients. And that takes a lot of effort to be able to communicate about different things. And that communication comes in writing, it comes in verbal communication, it comes sometimes in nonverbal communication. We're able to pick up nonverbal cues sometimes when people are in a place of discomfort and can't figure out how to communicate, or maybe physically just cannot communicate. We are excellent at picking up on those things. Nurses are considered one of the most, if not the most trusted professions in the country, which is awesome. I truly believe that we do deserve that title, that role. Sometimes it's a little bit intimidating because, we want to make sure that we are protecting people at all costs, but we also want to make sure that we're not making any mistakes. So it's a little bit, I say that being the most trusted profession piece with a little bit of hesitancy, because I want to normalize that nurses are people too. And while we are we're some amazing beings, we have our, we're normal too, but it is, I think, a positive that we are one of, if not the most trusted profession, which again should lend to the credibility of the content that we write and put our name on. Nurses, like some physicians and other professions, we do have a wide array of specialties that we're in. You have nurses who are in public health. You have nurses who are working on professional athletics teams. You have nurses who are working at Disneyland and Disney World. I'm kind of jealous of those of y'all who are in it. Like, send me an application and let me know how to get in. We have nurses who are in cardiology. We have nurses in mental health. We have nurses in GI labs or cath labs, and we have nurses really kind of everywhere. And so it really speaks to the versatility of nurses and their ability to really, again, take care of people in all different arenas of life, but all different, most different body systems as well, which is pretty cool. A lot of people don't know that, by the way. A lot of people don't know that nurses can specialize in specific components of science and medicine, and we can, which is awesome. And then the last thing is that nurses, like some other health professions too, have a lot of experience in healthcare systems. Healthcare is very much a business. But you also have nurses who are a part of those business decisions and are really working hard to make healthcare affordable, accessible, and of quality. So there are a lot of things that qualify nurses, I believe, to be health content writers. And if there was something that I missed, please send me a comment, send me a note, and let me know. And I would love to add to this video and demonstrate for you guys why health content writing is definitely an arena that you can step into without any additional training or credentials, if you will. So if you like what you've heard, please subscribe to my channel, and I'll see you guys next time.